Welcome to the Pivotal Podcast. Today we're joined by Hapse, a seasoned healthcare professional with over a decade of experience in performance improvement, patient safety, and regulatory compliance. Currently serving as the Director of Performance Improvement at Prime Healthcare, Harsh has worked on numerous initiatives to improve patient outcomes, streamline processes, and ensure compliance with CMS and Joint Commission standards. In this episode, we'll explore Harsh's career journey, the projects he's working on now, and his insights on building and leading high-performing teams in healthcare. Harsh, thank you so much for joining me today.
Hey Ben, thank you so much. Thanks for the invite and looking forward to have some good discussions.
Yeah, absolutely. So let's jump right into where I always like to begin, which is at the beginning. How did you begin your career in healthcare? And then what led you to focus on performance improvement?
Well, while I was growing up, I always wanted to get into healthcare and help others in need. So I got into the pharmacy school, did my bachelor's from India, from a city called Pune. At age 22, I came to United States for my higher studies. I got my master's in healthcare management from Cal State University, yeah, right here in Long Beach. And during my coursework, I took quality classes. I met with my professors, worked on some projects, and that really interested me to see how the US health system is set up and the challenges and opportunities it faces. I was fortunate to work under some passionate professors, mentors, leaders. I was able to get into some internships that let me focus and understand the quality improvement projects and initiatives that are going all over the United States. And the research out there was really interesting. And luckily, I got my first job in quality field, quality and performance improvement, and then since then, I'm into the same company. It's been 13 plus years. Started as a coordinator at a hospital, moved up into managerial positions at the corporate office, and now I'm overseeing two hospitals right here in Orange County, California.
Wow, that's pretty amazing. I mean, number one, I don't, for some reason, it never occurred to me that quality was something that you could study to go into. Um, and secondly, did you say that, and I thought that I knew this before, but you've been at the same company your entire career?
Yes, that's
That's
true.
amazing. I mean, that's
Yeah.
almost unheard of, right? That's incredible.
No,
Yeah.
I'm lucky to have a good opportunity, and I'm working with a really good leaders and good team.
Yeah, that makes all the difference for sure. So you've had some pretty interesting educational pivots, right? So you mentioned a degree in pharmacy, and
Mhm.
then you've got is it an MHA that in healthcare administration,
That's correct. Yeah.
right? And you've also added an RN to that, right? So how did number one, I want to know where the RN came from because it wasn't immediately following the others, right? It was a bit later.
Yes.
So I'd love to hear about that. And then I would love to hear about how those academic experiences have shaped your approach to performance improvement to lead you to where you are today. So yeah, first off, like tell me where did the RN come from?
So, as I said, I've been in quality field. Having that medical background really helped get me into what I'm doing right now. And then I work closely with our physicians and nurses and other healthcare professionals. During my career, I thought getting that clinical degree in United States will give me that edge, grow my career goal, and at the same time, it improved my confidence. I know more. I can confidently talk to healthcare professionals about any case, any patient care issue, or any clinical aspect that I want to get my word out there during meetings, during one-on-one discussions. So that RN degree has helped me a little. I did get into it a little late, but it has helped me tremendously.
Yeah, that's amazing.
Yeah.
So now, how have those your different degrees, how have they shaped how you approach performance improvement and then led to where you are today?
Yes, so Benjamin Franklin rightly said, right, the investment in knowledge pays the best interest. So throughout my life, I've gotten multiple degrees and certifications, and that has helped me build the foundation. It has opened my mind to different thoughts and possibilities during the programs. I was able to interact with our professors, colleagues, researchers. I was able to get into some internships for hands-on projects, and that has gained insight for clinical and non-clinical gaps in healthcare, and that's has shaped my approach towards performance improvement.
Do any of the projects that you worked on from your internships, the hands-on projects you got to do any of those stand out in your mind? Do you remember any of those?
Yes, I mean, I was working with the organization where we were working on some drills. So, to be prepared for emergency drills. So, I was really able to work with some cool leaders and see how they approach a problem, how to interact and react basically during an emergency situation.
Wow. So with those, there was actually a performance improvement component to those. Is that right?
Yes.
So you guys were
Mhm.
having a drill, seeing I don't know, like what is the can you use that to kind of walk me through what like the performance improvement process looks like? Is it like, okay, this is how we're doing things now. This is our baseline. Let's analyze and find opportunities for improvement?
Yeah, so basically, we have these guidelines, state, federal guidelines that we have to follow during an emergency. So, based on those policies, we create our own hospital policy. So, which really drills down step by step in this situation, do X, Y, and Z. So, during an actual emergency, as a PI, I'm right there while the situation is ongoing, and we are making sure that we are hitting all the points and there's no gaps in either providing care or basically acting upon that emergency.
Yeah, this is embarrassing to admit, but up until you just said providing care, I was thinking, "Oh, an emergency situation, like, oh, it's like a fire drill, you gotta get out," and it's like, you can't just get out, there are patients in there that still need care, right? So that's
Yeah.
gotta look wildly different than, like, the drills that I grew up with in school where it's just like, "Everybody outside," or "Get under your desk, there's an earthquake," or something like that, right?
Yes. Yes. Yeah. Hospitals, I think they have to notch it up because there's different kinds of emergencies that can happen. As you said, fire, but at the same time, we have to think about our patients' safety as well.
Yeah, that's amazing. And
Yeah.
out of curiosity, if you had a drill like that with patients, I mean, I'm assuming you're practicing maybe in more of like a, maybe not a classroom, but like a scripted setting to where you're like, okay, this person, you're not actually evacuating real patients for like a fire drill, right? Like that's not their healthcare
Mhm.
services aren't going to be interrupted for a drill. But do you guys simulate things like that? Like, okay, there's a person on this bed and we've got to wheel them out with this equipment and keep it all connected to power.
Yes, yes, that's required from the state that hospitals have to conduct certain amount of drills. There are times that we, as a county, have a drill, county-wide drills where multiple healthcare organizations are part of it. So in hospital to a county-wide drills happen every year.
Wow.
Yeah,
And so do people know those are coming in advance?
some of them are they know, some they don't, yeah.
Yeah.
We try to
Wow.
keep it as a surprise, so
Yeah.
we wanna see their participation and how they react, and if that education has really helped during an actual emergency.
Yeah, that's incredible. It's crazy the things that I've just never really considered before. Like, what does that look like to make sure we're actually prepared for the event of a real emergency? Huh.
It's never a dull moment working in a hospital.
Yeah, I'm sure. So let's shift gears just a little bit.
Mhm.
I'd love to hear more about how data has informed your role in process or performance improvement, process improvement. Um, and yeah, so specifically, how do you define health informatics?
So basically, from my background and experience, health informatics is basically using information technology to build a data flow. So knowing what we want, what's our goal, and building a workflow to collect, analyze, and analyze the data, right? So if it's a meaningful data, it can make sense. We can make some meaningful changes in healthcare processes to improve the way we deliver care to our patients.
Sure. That makes
Mhm.
sense that you start with an end goal in mind and then reverse engineer the workflow to get you the data that you can
Yeah.
analyze to improve a process to get there.
Yes.
Okay. Cool.
Mhm. And then
Um,
being part of PI, my department oversees quality improvement initiatives, patient safety issues, risk management, and regulatory compliance initiatives. So data is core to our department. It involves collecting data right next to patient's bedside while the nurses caring for the patient, whether it's giving a medication or collecting vitals. All this data that is collected gets documented into the electronic medical record system, which is called the EMR. And that's when we can look at the big picture and look at trends and make sure we are providing the best patient outcomes.
hmm.
Mhm,
So diving in a little more specifically to your current responsibilities as director of
mhm.
performance improvement, um, what are those current responsibilities?
So currently, I'm overseeing two hospitals, performance improvement department, which is part of a big system called Prime Healthcare. As I mentioned, we work closely with physicians and nurses to make sure we are compliant with the CMS regulations and Joint Commission standards. So it's mostly revolves around best practices, value-based care, involves data collection through audits and data abstraction from the electronic medical record systems, looking at trends for some of the key quality measures that we keep track of, whether it is any patients that are on anesthesia, how are the outcomes post a procedure. So some of the impactful projects that we have worked on is improving sepsis compliance and reduce complications. We are also working with our physicians and trying to follow these new American Heart Association guidelines to treat heart failure patients.
Hmm, okay.
Yeah.
So you guys have obviously these guidelines that come from CMS, and then
Mhm.
you look at what your current perform I guess how your current performance compares to the guidelines and the standards.
Yes.
And then things for, sepsis and other, like, surgical outcomes, right?
Yes.
Um, and then how do you figure out what, uh, what steps to take to improve your adherence or your compliance?
Yeah, good question, Ben. So basically, when let's say if there's a complication, right? So we need to go down to the root cause and see whether it's a process issue, a personnel issue, and really take it as an educational opportunity to work with with our staff to see how we can improve. Is the hospital policy being followed? Are we are we are we taking all the steps that are required for the best patient outcomes? If
Mm,
not, then we have educational initiatives. We have in services that's like one-on-one education, and there's a lot of resources out there that help us. We have also educators, we have clinical leaders who are involved in making sure we meet our goals.
very cool.
Mhm.
So, can you tell me about some of the challenges that you've faced in regulatory compliance and, how you've overcome them?
Yeah, so hospitals get surveyed regularly to make sure they're in compliance, right? So during a recent survey, one of the surveyors was asked about the patients that get transferred out of our hospital because we don't offer that service or the patient needs higher level of care, right? So when we looked into our system, uh, we looked at the current workflow and we found duplication of efforts where there were forms that were filled by physician, nurses, and they were not consistent. So what we did was we worked with our IT team, we worked with our reporting team to standardize what's really needed and how we can avoid the duplication of documentation and make sure that accurate documentation is built so and the staff is educated to enter the data and then we build the reports around it. So then we can pull the data, analyze it, and meet the regulatory requirements. It is also challenging to share that um, right data should be presented to the right audience, right? So that's one of the challenges that we've seen is the same information if I'm talking to a physician versus talking to a nurse. So sometimes nurses like more a visual presentation. So we have these boards where talk about some of the initiatives that we are doing versus physicians, which sometimes are hard to get hold of. So we have to be on point and concise to what we're trying to see or achieve.
So something that stood out to me there was you talk about um, identifying somewhere in the process that
Mhm.
efforts were being duplicated, right, between physicians and nurses. And on one hand, it makes sense that you could improve um, the experience for the care providers by removing redundancy, right?
Right.
And just
Mhm.
having one individual um, be responsible for that, especially because with duplicate efforts, I guess there are opportunities for conflicting data. I think you mentioned, right? But
Yes.
I wasn't sure if maybe would it ever have been built initially, as an intentional redundancy to make sure, like, "Hey, this is actually a double check to make sure that the things that we're talking about, um, uh, yeah, are covered," or,
Mhm.
like, we're do you know what I mean? Like, there's
Yeah.
agreement there, so, like, we're doubly sure that all of these things have happened, where it's like, no, it's actually better to only do it once, get it right, and then not worry about the redundancy, save time, and yield better outcomes.
Yeah, in this situation, we found it was duplicate. But yes, you're right. There's times where uh, documentation from the physician perspective helps versus the nurse perspective. So in certain areas, yes, we do want that complete picture of the care that was given to the patient. But in this situation that I mentioned, it was the same set of questions, but we were getting discrepancies because they were entering different information. So rather than a free text, we build standardized drop-down options to make it easy for data entry and collection as well.
Yeah, I can
Mhm.
see definitely how designing the workflows is going to impact the quality of uh, data. Well, it's the quality of data that you're going to get out from it. It's going to impact provider experience, and it's also going to impact the outcomes, right, in patient care.
Mhm.
Yeah.
Yes.
All right. So, Harsh, how do you use data and informatics to drive performance improvements and enhance patient safety?
Yeah, that's the really crux of what we do in the hospital, and it's a really interesting question. So, we recently are working with our pharmacy team, IT team, and our nursing staff to improve barcode scanning of medications. So basically, when the nurse walks into the patient room, they need to scan the patient's barcode, right, which is in their the wristband and the medication. So that really helps reduce the medication errors. We want to make sure it's the right medication for the right patient. And then to reduce medication errors and improve patient safety, we have the nurses scan, right? Both things. And then this scanning gets recorded into the electronic medical record system. So if the scan doesn't work, so there's some discrepancy in the workflow. Either it's not the right medication, right dose, or it's not the right time to give that medication. So that really helps using data right next to the bedside, next to the patient, to avoid that error. And then if that error happens, patient can have side effects, minor to major ones. So we track the scanning compliance by department, by users. We look at trends and then focus on the low performers. So basically having a clear goal, what we are trying to achieve, and then collecting that data. It's only possible if we want to make those improvements is to really know what we have to do, how we're going to do it, and tracking the compliance over time.
Yeah,
Yeah,
that definitely makes sense. So you've got to have a process in place, and then people have to follow that process.
right.
Yeah, and
Mhm.
yeah, and very I can see very serious, consequences, I guess, could happen, if
Mhm.
that or when that's not followed for sure.
Yes.
Um, Super interesting. So, thinking about, performance improvement, uh, specifically, okay, so you mentioned being over 2 hospitals. What does your
Mhm.
team look like?
So we work closely and collaborate with our corporate counterparts. We have a big team. We get support from corporate, but at the same time, at the hospital, I have two really good coordinators that assist me. Uh, and the corporate supports the hospitals on various projects to meet the reporting requirements, again, set forth by the state and federal Department of Health.
So so the coordinators are working on, the requirements, right, and making sure that
Mhm.
there's compliance, and I'm sure that there's a component of, like you mentioned, like, education and training, right?
Yes.
Um, and then what else goes into performance improvement, I guess? In our previous conversation, you mentioned, complaints. Can you walk me through, like, what that process looks like and I thought that was really interesting, like, the practical application of having a complaint system in place.
Yes, yes. So we get complaints or concerns not just from the current patients that are in the hospital or the staff, but also patients once they are discharged. So if they have any, they go home, they have some side effects, they can always call and express their concerns. That's when I work closely with our clinical leaders, look into the electronic medical record system and see what care was given, how it was given, were there any gaps, were there education. Sometimes patients are not aware of this complicated healthcare system. So really explaining things, breaking the care down in layman terms really helps. So it's usually talking to the patient, family, um, acknowledging their concerns and really walking them through how the care was given, what care was given, and what to expect. Because as humans, we react to medications in different way. So it's really just getting that information to the patient and family in easy terms, basically easy words
Sure,
that they can
sure.
understand. Yeah.
Yeah, that makes sense. So some of the complaint resolution is probably just making sure that, there was clear understanding of what was happening, right? Like, "Oh, you did get what you needed, and here, let's just clarify your understanding there."
Yeah.
Um,
Because
but
it's
then
a overwhelming experience coming to a hospital and you're not well and there's people walking in and out of the room taking care of you. So it can be a lot
yeah.
to digest. Yeah.
Oh, for sure. Yeah, so much, and I mean, especially, if you're there for any length of time, um, it would be easy to forget or to be unclear on, "Oh, this is what happened. I actually did have my needs met, I was cared for properly." But then what happens in the event that you find, okay, you go clarify with a patient or their family, and something was missed? Then what happens?
So that's when the quality improvement principles come into, right. So how can we improve ourselves, how can we avoid similar situation from happening again, right. So that's the core of quality improvement. So that's when we look at the process and see, hey, was the policy followed, did we miss anything, or do we have to basically go back and look at our policy. Maybe that's something that we need to improve. We need to improve the process or the workflow of the care. That's just really going back, drilling down to the details and making that change.
I'm envisioning like a decision tree or a logic tree, right? And it's like, was policy followed? Yes. Okay, if gap exists, change policy. Or it's like policy was not followed. Okay,
Yeah,
educate staff. Or
yeah. Sometimes it's not always black and white. There's a lot of gray area when it comes to healthcare, but as we're evolving, we're learning, and there's more research out there, there's more best practices out there that we can rely on and learn.
so you mentioned having, staff in the hospital,
Mhm.
the hospitals, and then also support with corporate staff. Um, how do you collaborate with corporate and then also the hospital staff to achieve your goals and performance improvement?
So we have our set expectations, what's needed, what's not, who is going to do what. So when basically my team at the hospital is on the ground, right? They're talking to the nurses, educating, collecting data, auditing, looking into the charts. We are in the electronic medical record system every day, looking at patients' chart, collecting some kind of data. We look at um, any complications, infections, any mortalities that happen in the hospital. So we're constantly in the chart, looking at what was done and what could be done. Was the care appropriate? And just collecting that data. And each department in our hospital has a few of the quality measures that they have to track, right? Because they know their department. So they come up with some goals for the year. See, okay, I'm going to improve this process. I'm going to educate my staff, and I'm going to improve the outcome by 10%, right? So that's something that we keep track of. Also, if we have surveys, whether it is state or federal surveyors in the hospital, if they have any findings, then we again have to come up with a quality improvement indicator, how we're going to improve ourselves and how can we sustain over the period of time. So it's very interesting that we house all the data so we can make sense out of it and guide clinical leaders, clinical providers, and how we can improve and achieve our goals.
Yeah, I love hearing about this because a lot of times, I feel like when people think about health informatics, they think about the workflows and all of the things, like especially providers, right? Like all the things that are taking their focus and their time and energy that's not necessarily directly providing care, right? But here in performance improvement, you're actually using all of that information that you're collecting to make sure that the appropriate care is provided at the appropriate time.
Yeah, yeah, it can be for a heart failure patient. Is that beta blocker prescribed at discharge? That's one of our indicators. We want to make sure our heart failure patients go home, get discharged from the hospital with that beta blocker prescribed so they can go get their medication at the pharmacy and follow the aftercare, right? So once they're home, they have to take care of themselves. That's just one example. And not just clinical, we also collect non-clinical data, like let's say our housekeeping staff, how fast they're turning around the room. So once the patient is discharged, how quickly is the staff cleaning and getting that bed ready for the next patient? Because that can be a bottleneck for the workflow as patients come into the emergency room department. And if they get admitted, is that bed available on that floor? So we want to make sure that workflow starting from the ER entrance, ER as in emergency room entrance, to all the way till the patient makes it to the bed and gets discharged. So we look at the whole process. And of course, as I said, informatics goes, we collect the data as the patient goes, right? So informatics is part of PI. I mean, we work closely with our IT team and informatics team.
Having that data there, that had never crossed my mind before, having the data about the housekeeping, and it
Yeah,
totally makes sense because that absolutely that wait time 100% impacts the patient experience.
patient
And they're not just
experience.
experience, but, like, their health outcomes too, probably if it's delaying care, delaying, like, their access to the room that they need.
Exactly. Yes.
Super interesting. Um, so what are the key challenges that you face in building and then leading a performance improvement team?
So coming back to data, we live in healthcare world where if it's not documented, it's not done. So we are on that continuous high reliability journey where we want to improve our patient outcomes. We want to review the culture of patient safety, our staff satisfaction, our patient satisfaction, and really review our opportunities, and then educate our clinical staff to make sure they're following the standard of practice. So that's the challenge that being in PI is when it comes to building, I mean, building and leading a PI team, it really helps if a candidate it has that clinical background because you're looking into the clinical data, you're looking into the patient's diagnoses, and looking at the how the physicians and nurses are documenting the care provided. So whether it is turning a patient who has a wound every 2 hours, making sure the vital signs are collected regularly based on hospital policies. So knowing these ins and outs of healthcare really helps when it comes to candidates that are applying to be part of PI. So I can build a good team who also has that analytical uh, knowledge. It's data, but also making sense of that data really helps in PI. And these are some of the challenges. I mean, not just healthcare. There's a lot of other industries are having um, staffing shortages. Same thing in healthcare. We still have nursing shortages. We are always hiring for nurses, not just in our hospital. It's all over United States.
Yeah, so having available talent, but then also the right mix of skills and experience, and it I can see how the clinical experience would reinforce probably the standards, right? A person has been used to implementing those and also knowing the reasoning behind why those steps are necessary, and probably has um, maybe better intuition even to look for, okay, this should be there, and maybe being able to recognize when something's out of place.
Correct. Yes. So I think a good candidate will be someone who has the clinical knowledge, maybe some kind of experience, clinical experience, either working as a nurse or in some healthcare capacity. And then on top of that, having that analytical mind where you'll have to critically think beyond what the data, not just the data, but what it means and how we can improve from there.
Yeah.
Yeah.
Interesting. So, have you seen, in performance improvement, people make a transition directly from, say, the bedside into performance improvement?
Yeah, we have a lot of nurses that are interested um, in performance improvement. It's a vast field, interesting field where you're not just looking at a patient, but we are looking at the same at a patient, but at the same time we're looking at a bigger picture, looking at thousands of and thousands of data points, and really looking at what's needed, what's the goal, and are we moving in the right direction.
I think that's so interesting because for the longest time, I've looked at health informatics as offering a viable career alternative for someone that had some sort of healthcare background, and that maybe they were experiencing burnout, or for some reason they were ready for a different direction in their career, but they wanted to
Mhm.
leverage their background to move forward, right? Um, and I hadn't considered performance improvement before, but it totally makes sense as to how that could be a really great next step for someone who said, "Hey, I've got this valuable bedside experience. I want to leverage that to continue to make a difference, but being at the bedside full time administering care, maybe not the right fit for me at the moment."
Yeah, yeah. A lot of people do transition eventually in PI once they're clinical for a few years, and then they want to still be in healthcare at the back end, making that change that they want to.
So, what advice would you give to healthcare professionals who are interested in making that transition into either PI or health informatics?
Yeah, I mean, any clinical as well as non-clinical professionals can transition into performance improvement or health informatics if they're interested. I think having that right education um, and someone who can deal with clinical data, having that medical degree is highly preferred. And if they are in the early in their career, internships, fellowships will give them that knowledge they need to make that transition into the performance improvement or health informatics. Being part of healthcare professional organization also helps. There's quality organizations. There's a National Association of Healthcare Quality. There's also American College of Healthcare Executives or American Society of Quality. that will help you broaden your network, meet with like-minded people, and really stay up to date with current healthcare trends, and then you can transition into the performance improvement healthcare informatics.
Yeah. So with the data analysis, right, and that analytical mind, um, are they actually diving into, like, say, taking raw data and making sense of it? Like, where is there a data analysis component?
Yeah, yeah. I mean, as I said, we are in the medical record. We are looking into the chart. We're looking at the documentation. We're looking at what care was given. Was it documented? Was that medication given? Was did that nurse make that follow the policy? So that is just for that patient. But as we add on, as we audit or we collect more data, now we're looking at thousands of patients at the same time. So that really uh, looking at the big picture is really important to make sure we are meeting that goal and making that change. Is even if let's say we do like a PI project, okay. So this involves okay, we changed the workflow, we educated our staff. Now they know what to do, how to document. Okay, so let's keep looking, keep track of it for next few months and see if the needle is moving. If not, what happened, what where are we going wrong, do we need to revisit and see what's being done or what's not being done.
Are there specific, like, data tools, data visualization tools, data analytics tools, that would be useful for somebody to know if they're interested in transitioning to PI?
Yeah, there's a lot of clinical tools. There's lean management, Six Sigma. There's also simple tools like PDCA, which is plan, do, check, act, and that's what we use. It sounds simple, but it's basically a cycle. So we are planning what we're planning to do. D is doing. So basically looking at what are the best practices, what is our policy, how are we going to approach this problem, right? And C is plan, do, check. So now we're collecting, checking the data and making sure if we are moving in the right direction. And then act. So once we look at the data, we need to act upon it. Basically, are we moving in the right direction? If not, okay, let's go back and revisit this. Maybe look at this research article that says this might have worked. So we go back, make that change, and let that cycle continue. So plan, do, check, act. That's this PDCA cycle that we use day and day night.
Sure. Yeah, that framework makes a lot of sense. It sounds like that would be super helpful. What about things like knowledge of, like, SQL or Power BI or anything like that? Like, is anything that technical required for somebody who's interested in transitioning to performance improvement?
Not really, but having that knowledge will help. But we do closely work with our information technology team that has those expertise that we can always rely on.
Yeah, that's great. I love that because it's less of a barrier maybe for someone to make the transition when they're ready. They've got that really useful clinical background that they want to leverage, and they don't have to worry about going and getting. And correct me if I'm wrong, but it sounds like they might be able to make that transition without going back to school and getting another degree. Is that fair?
Can you repeat that question?
Yeah. So say there was a nurse that was interested in transitioning to performance improvement,
Mhm.
would they be able to make that transition just with their clinical background that they have, without going back to school for an additional degree?
I would say yes, but having that healthcare management degree or public health degree that will really um, expose you to certain concepts that you might not have been exposed to during your nursing program. So I would say go back, get your master's in healthcare management, public health, and that will give you some hands-on projects and you look at some theories, some principles out there that are really helpful when you transition to performance improvement.
Cool. That's
Yeah.
helpful. That's super good. Um, Harsh, before we get out of here, is there anything else that we wanted to cover today?
Think we covered most of it. Yeah, it's an interesting topic. I mean, have guided a lot of freshers who are new in this career. I've guided a lot of them. I've been mentor for many of them. So it's not an easy task, and it takes time to understand the full picture. Healthcare, again, it's a complicated field, which is fragmented in United States, unfortunately. But um, we are here part of the quality improvement to make small changes every day.
Yeah, well, those add up over time for sure, right?
Yes. Hmm.
Yeah, well, Harsh, thank you so much for being with me today. I've really enjoyed the conversation, and it's really opened my eyes to the opportunity for performance improvement to provide another gateway for a transition for people in healthcare.
Yes, it was a really good discussion. Thank you, Ben, for giving this opportunity.
Yeah, absolutely. Um, and to our listeners, we hope this episode's provided valuable insights into the evolving landscape of healthcare and the critical role of performance improvement. Feel free to share this episode with anybody who might benefit, and stay tuned for more discussions on